are in listen-only mode.
Okay. Hey everyone, this is WSPT with the Cervical Seminar, and this is Jason Ruda.
So our webinar today is going to be on the cervical spine. We're going to begin by doing an overview of the anatomy. We're going to go over some common issues or problems that arise in the neck, a lot of the diagnoses that we see on an everyday basis. We're going to go over some treatment options for for these conditions, both physical therapy-wise and surgically, and then we'll take some questions at the end. So first we'll go over some of the common questions that patients come in and ask us when they have neck issues. What are the most common causes? What is a bulging or herniated disc? Those are two terms that we often get, or they often hear from the doctor, but they don't get an actual good explanation of. A bulging disc would be the, I guess you want to say, the first phase of an issue with the disc, where the disc begins to break out partly from its inner shell, but not completely come out. A herniation of the disc is when the disc completely breaks out of its inner shell and is now can be resting on a nerve root or your spinal cord, which is where you're going to get that intense pain or some pain running down either your arm, either your right or left arm, depending on what side of the nerve root it's pressing on. A pinched nerve is kind of a 10-cent term that it's used. It's kind of thrown around. That refers to a nerve root being compressed, whether by a herniated disc, or it could be from an extra piece of bone, a calcium deposit known as a bone spur. But we'll get into that a little bit later on. Neck pathologies, how they diagnosed. They can be done through X-ray. If it's something that's on an X-ray, you can see that there's less space, let's say, in between each vertebrae, which means the disc may be starting to break down. If it's something that needs to be seen a little bit more clearly, an MRI may be ordered in order to see if it's a specific disc level or if a nerve root is being compressed by a disc, as we spoke about shortly a little while ago. What do I need to do to prevent neck injuries is a common question we get. Big part of that is postural correction. With a lot of people being employed in jobs where they're sitting at a desk for long periods of time, your sitting posture, your standing posture being, as proper as possible, is going to go a long way towards you avoiding neck injuries down the line. How can my posture cause neck problems? Being in poor posture or in a posture that's going to stress either muscles in your neck or the other structures in your neck, being in a poor posture for, let's say, 5, 6, 7, 8 hours a day can be just as painful, or it can be just as destructive on your neck as something traumatic. So posture can play a huge role in leading to neck injuries down the line. How does an injury in my neck cause pain in my arm? Again, that goes back to a lot of times disc involvement, where the disc is out of its core, out of its shell, and has kind of leaked out and now is compressing on the nerve root, either on the left or the right, or it could be both. And that compression of the nerve root will cause symptoms down the nerve, depending on what level you're at, corresponding to the level on your arm. So we'll do a quick review of anatomy. The bones, there's 7 cervical vertebrae in your neck. The first cervical vertebrae is what's called the atlas. It's referred to as the atlas. That's what kind of holds the base of your head up onto your neck. The C2 is referred to as the axis, and that's what allows it to, what you're kind of spinning or turning on when you rotate your neck or move side to side. You have ligamentous structures on both sides of the cord. They give it extra support and stability. Muscles, of course, you have running up and down both sides of the spine, connecting on both sides of the spine. That's what allows you to obviously to move in rotational planes and in side bending, and it allows you to flex and extend your neck. The disc, as we said, is made up of two parts: the nucleus pulposa and the annulus fibrosa. The nucleus pulposa is the inner core, if you want to say, and that's what when something begins to bulge, it'll start to leak out into the annulus fibrosa. If it starts to completely leak out and break through that annular region on the which is the outer ring, that's when you get what's called that's when the disc is then progressed to being herniated. As you can see, the nerve root off to the left of the purple annulus, that's when the disc material from the turquoise nucleus will leak out and then compress that nerve root. The cord itself runs in the spinal column, which is the way that your vertebrae are aligned. There's a hole in the middle of them. That's what your cord will run through, from your neck through your thoracic and then through your lumbar vertebrae at the bottom. The nerve roots are what exit the sides of the spinal column, and out of there's a small opening on each one of the vertebrae that the nerve root comes out of, and those are what will innervate. When we're talking about the neck, at least, those are what gives you the innervation to your shoulders and your arms and your hands, and so forth down the line. If we're talking about your lumbar vertebrae or your low back, those would be the roots that would innervate your hips and your knees and down your leg into your feet. The facet joints are kind of a sliding joint that are on either side of the vertebral body, and they kind of open and close as you flex and extend and side bend and rotate. So they're put on about a 45-degree angle to each other, and they slide up and down and open and close as you move. And the atlas and axis complex I spoke about earlier, that's your C1 and C2. The atlas being what holds the base of your head, and the axis being the rotational axis for your head. The annulus and the nucleus, the annulus fibrosa and the nucleus pulposa, as we said, those are the inner and outer rings of your disc. When the nucleus starts to leak out by either trauma or from poor posture, just being compressed on from the front or the back, it'll start to leak out of its softer inner level, and that's what's called a bulging disc. Once it breaks through completely through the nucleus pulposa, through the annulus fibrosa, and is then completely broken through, that's what's known as a herniated disc. And just a little bit more on the disc. The disc you can think of kind of as the shock absorber of the spine. So in between each vertebrae, you have this disc that, especially when you're standing or in weight bearing, your spine is then compressed. So that's what gives you the kind of cushioning in between your vertebrae, so that your actual vertebral body is not compressing on each other. And over time, whether you've been injured or, whether or not you've been injured or even have poor posture, the water that makes up the majority of that disc, tends to decrease, and your discs tend to get lesser in height as you go along. So, unfortunately, as we age, so does the disc, and that allows you to have less of that cushioning as you go along. We'll talk about movement now. When you bend your head forward or flex it, there's actually two parts there. There's capital flexion, which is your upper neck bending, and then you have flexion, which is the entire neck, or the rest of the lower cervical spine bending. So that would be as if you were bringing your chin down towards your chest. Extension, or looking backwards, is when you look up is when you bend back and look up towards the ceiling. Side bending is the motion associated with bringing your ear down towards your shoulder, going either left or right. And then rotation, obviously, is turning of your head to look over, let's say, your left shoulder or your right shoulder. We can, later on during the program, we'll go through what are the primary muscles that allow you to flex, extend, side bend, and rotate. Just some typical dysfunction now of the cervical spine. A fracture, obviously, like any other bone in the body, is generally from something traumatic. I mean, it can be with a disease like cancer, where it could be non-traumatic, where the bones just start to break down. But usually something traumatic, where the bone breaks, and that's obviously a little bit more complicated in the neck as opposed to, let's say, your wrist or your knee, because of the nerve innervation that's in such close proximity to the bones. So with a fracture, though, a lot of times it will just be the patient will be immobilized, whether by a collar or if it's more complicated, maybe some internal fixation, in order to allow it to heal properly going forward. Muscle strain or ligament sprain, again, is, even though it's the neck, it's very similar to any other part of the body where, whether it's, let's say a car accident, we have something what's referred to obviously as whiplash. You can strain the muscle and cause it to go into spasm, where the body kind of reacts to the trauma to protect itself. And the same thing with the ligament, it might be overstretched by having something traumatic happen. Bulging and herniated disc, we talked a little bit about. That can be from poor posture over time, or something traumatic where the inner I guess we want to say layer of the disc begins to protrude out. Once it starts to protrude partially or into that outer level, that outer layer, we refer to it as bulging, and then a herniated disc is when it completely breaks through the outer layer, which is a little bit more, which is a little bigger of an issue and can now involve radicular symptoms where you're pressing on a nerve root. Nerve root impingement, somewhat similar to what we spoke about in the disc, where the nerve root, either going out to the left or the right, is compressed upon by either a herniated disc, or it could be a bone spur that's maybe grown off of the vertebral body that's actually now, pinching, if you want to say, like we said, that's kind of a 10-cent term, pinching that nerve root and causing you pain down the corresponding nerve pathway that nerve root is innervating. Facet joint dysfunction, as we said, those are the two sliding joints that you see on the picture here, where you can see those in between the vertebrae, towards the left on the screen. You see that connection of the vertebrae, the top vertebrae and the one underneath it. That's the facet joint, and they slide open and closed during flexion and extension, as well as side bending and rotating. If for some reason they get stuck, that'll hinder your motion or limit your range of motion. And that's something that we oftentimes, something very common that we treat with therapy in order to restore normal motion, is to free up that facet joint sometimes if it gets stuck. And it can be very painful at times as well. Postural dysfunction, like we said, is just someone who has what's referred to as a forward head, where their head is not so much neutral but kind of sitting forward on their neck, which is something you see a lot. Somebody who's on a computer all day, staring at a screen. Also someone with forward shoulders or rounded shoulders, that puts a lot of stress on the muscles that surround the neck and the shoulder blade, and that can lead to issues down the line as well. Risk factors for dysfunction. So there's both structural and social. Structurally, scoliosis, which is a curvature of the spine, which generally shows up in people as adolescents. If it's severe enough, they can actually be braced in order to prevent any further curvature of the spine and keep it at bay. If scoliosis is very severe, we have patients who actually have to undergo surgery and have their spine straightened out and have hardware like such as rods or screws put in. Increased or decreased lordosis, that's when your spine is curved not so much side to side as in a scoliosis, but front to back, where it's either you have your spine is either kind of stuck in a little bit more of an extended position or in a flex position, and again that'll lead to issues of stability down the line, whether it's a disc issue or limiting your range of motion just because of the mechanical disadvantage you're now put at. C1, C2 instability. C1 again is what's holding your head onto your neck or what's supporting your head on your neck, and then C2 is the axis by which you're rotating and side bending and moving on. So if that's unstable in some people, that can be a surgical issue down the line. It can lead to pain, obviously, because you're hypermobile, you have too much movement, so now your supporting structures like your muscles and your ligaments have to overwork to kind of make up for that instability. On a similar note, ligamentous laxity, if your ligaments are such that they're lax or not as taut as they should be, that can lead to instability down the line of the neck and cause the other structures to kind of have to compensate for that, and that also can lead to issues down the line. Social factors, age, as we said, as you get older, your discs just tend to degenerate as you go along. Some obviously worse than others and faster than others. They tend to break down. So age is always going to be a factor with any kind of spine issue. Gender and occupation, depending on what kind of line of work you're in. First thought would be that if you do something like construction or something with heavy lifting, that you're a lot more likely to incur a spinal injury. Maybe not so much the case, like I said, someone who's sitting in front of a desk for 8, 10, 12 hours a day and with poor posture is probably doing themselves just as much harm as the person who's doing a lot of physical labor. And the person with physical labor also has to be very aware of their posture in order not incur a neck or any spine injury. Recreational activities is always a factor. I mean, we always, as therapists, encourage everyone to be as active as possible, and whatever that may be, in whatever sport or activity that might be. But something that's more of a high contact activity, such as football, or if you want to say hockey or lacrosse would be it, is always going to predispose you to having a high impact injury, a lot more than, let's say, tennis or something of that nature. So that's always going to increase your chances somewhat of having a cervical injury. So just some tips in preventing cervical spine dysfunction. As we said, maintaining proper posture, keeping your head in as neutral of a posture or neutral as a position as possible, not sitting with your head kind of reaching forward for your monitor if you're on a computer all day. Postural awareness with functional activities beyond just sitting. As I said, with someone who's, let's say, a construction worker, being aware of your posture when you're doing, let's say, your job or your recreational activities, because it's just as important to maintain that posture during functional things as it is, when you're sitting, let's say, even watching TV or laying down to watch TV. It seems pretty common sense, but avoiding aggravating positions or activities. If it's something where there's a position, let's say, or an activity that you notice consistently is aggravating your neck symptoms, be smart about it. Stop doing them or avoid them. Maybe speak to a physician about, or a therapist about whether you should eliminate this activity, or sleeping, let's say, in a certain position altogether. Are you doing yourself a lot more harm than you are good? Home exercise program, we encourage a lot of stretching for tight muscles if it's, somebody it's a postural dysfunction for, strengthening or stabilizing an area, whether that's the muscles surrounding your neck, muscles surrounding your shoulder blade or your mid back, because if you're, let's say, if you have lessened motion, let's say, throughout your mid back, that can lead you to being hypermobile or being too mobile in your neck to kind of compensate for the loss of motion in the mid back. So having a stable spine or having muscles that stabilize you and keep you in a good posture is extremely important. Nutrition, homeopathic, vitamins. There's a slew of products out there that supposedly help lubricate your joints or keep you joint healthy, and I think some of them are definitely worth looking into. I would definitely consult a physician before beginning to take anything over the counter. But there are products out there that I've heard some patients say that it have given them some relief, and as opposed to having to go onto medication, have afforded them some relief. This is just a couple pictures of an ergonomically appropriate workstation. So again, we said, with more and more people being at sedentary or desk jobs or being at computers at home, working from home, sitting in front of a computer for 2, 3, 6, 7, 8 hours a day can be just as harmful to your body as as something traumatic happening, in, whether it be in a car accident or at work. So just want to keep your eye level, so that your head is facing straight ahead. You're not bending forward like in the first figure. Your feet should be flat on the floor, whether that's right on the floor or if you want to put a footrest to bring the floor up to you, if you want to say. Knees and hips should be in proper alignment. Shoulders should be back and not forward as you see in the first figure and a little bit somewhat in the second figure. And, is it possible to keep that posture for 8 hours straight? Probably not, but another little factor or maybe piece of advice, to give you is to, get up and maybe walk around or just, walk around your desk just to kind of get yourself out of that posture, maybe once an hour, just to kind of give you a reminder that when you sit down, you have to reset and get back into that proper positioning. As far as treatment goes, keep coming back to it, but, reinforcing to yourself and us reinforcing to our patients, proper posture is a lot harder to kind of get through than to teach any exercise. I mean, you really have to ingrain in somebody how important it is to break a habit of a poor postural, poor positioning, whether that be, as I said, at work. I didn't touch on so much of sleeping as well. I mean, you're laying in a position for 6, 7, 8 hours a night. If it's an incorrect position, I mean, you could really do yourself, a lot of harm over time. Avoiding aggravating activities, again, if it's sleeping posture, if it's sitting, if it's, something that you do recreationally and it's causing you pain consistently, you need to reevaluate, maybe stop doing that. And as I said, then consult possibly a therapist or a doctor, and, to see if going forward, maybe you need to eliminate this from your routine. Anti-inflammatory medication or pain meds, as always, you want to consult your doctor on this, but maybe to help you, if it's a chronic condition, something that you want to use sparingly or as needed to help you manage your symptoms. Physical therapy, obviously, which is going to be focused on, hands-on therapy to help you regain your range of motion as much as possible, teach you exercises to both strengthen and maintain the proper length of your muscles and maximize the stability in the neck. And posture is a huge part of physical therapy. Down the line, if it's a condition that's very chronic and, let's say, therapy and over-the-counter or prescription meds are not allowing you to manage, pain management is something that's been used, or it's a topic that's come up a lot more in, let's say, the last 5 years. And some part of that is involving anti-inflammatory injections right into the joints of the neck or near a nerve root to allow the inflammation around the nerve root to come down and thus eliminate the pain that's radiating into an arm. And obviously the last, but hopefully, can be avoided intervention is surgery. If it's something where you have a cervical level that's just completely unstable, or it's a disc that's completely herniated and compressing the spinal cord, which is, where you're putting the patient at risk for paralysis. Scoliosis, like we said, that's so severe that it needs to be, that it needs surgical intervention. These cases are out there. And we see a lot of patients who undergo surgery and are very successful and go on to lead, very normal and pretty much pain-free lifestyles. Just a little bit about cervical interventions. I'm just going to show you a little bit about, let's say, if you were going to undergo a disectomy or a fusion. With a fusion, depending on the level and the level of the severity of the disc herniation, they can go in posterior or from the back, like you see the line going down the gentleman's neck. They'll open up that way. If it's a disc herniation that's compressing a nerve root or spinal cord, they would cut away that part of the disc and then fuse from one level to the level below, usually with a bone either from the patient or from a cadaver, and then two screws are inserted to hold the fusion together. And those two vertebrae, now there is no movement that is going to occur between this level and this level. So from, let's say, that what you have open right here, those two levels that would no longer move, and there is the thought that down the line that can lead to issues above and below, because as we spoke about with the mid-back, now you have a level or an area that's not moving. The area above and below now is going to compensate for that possibly down the line by moving excessively, and that might lead to some instability above and below the fusion. Preoperatively preparing for surgery, again, getting into the habit of maintaining good posture, whether that's in standing or sitting or sleeping. Preparing your home for the fact that you're not going to be able to do many of the everyday chores that you take for granted when you get back. So setting things up to make it a lot easier for you, so that you don't have to reach or lift or overexert yourself when you first come out. And becoming familiar with the use of portable TENS machine. TENS machine is a portable device that provides mild stimulation, and what it does is it temporarily kind of confuses your nervous system and blocks a pain feeling by allowing the nervous system to pick up on the tingling or the stimulation that comes from the machine. And the idea behind it is just that it helps you manage or deal with your symptoms at a lesser level. And I think the biggest plus behind it is that you're not constantly on pain medication. It kind of takes the place of that medication temporarily. Maximizing post-op functional restoration, absolutely positively maintaining adherence to any post-surgical protocols that the surgeon has given you or instructions that he's given you, whether that's wearing a brace, avoiding certain movements, and when you begin therapy, only sticking to what you're supposed to be doing at that time in your rehab protocol. Regularly attending therapy at the frequency that the doctor and the therapist has agreed upon. Not adhering to this can really set you back and cause your recovery to be behind weeks and months. Making sure you maintain any of the home exercise any of the home exercises that the therapist may give you in order to truly reap the benefits of therapy. Again, utilizing a home TENS to help manage your symptoms, as opposed to using high-dose pain medications going forward. And maintaining a diet high in vitamin content in order to expedite healing. Just as a home exercise starter, we'll go over chin tucks, which is just a tucking in or bringing in of the chin to keep your neck in a more neutral posture to avoid that forward head posture that you see a lot with people who are, say, sitting a lot or on a computer a lot. Scapular pinches is just pulling your shoulder blades together and getting your shoulders to be back in more of a neutral or retracted position to avoid that forward shoulder hunched over look. Posture awareness, again, avoiding that forward head, keeping your back sitting straight up, because a lot of it starts at your lower back. If you're slumping in your low back, everything above it tends to follow through and slump forward, whether that be your shoulders and then your head. And then sleeping and sleeping postures, avoid that fetal position. You can definitely lay on your side. Try to keep the neck in neutral. If you're laying on your back, maybe just one pillow so that your neck isn't flexed up. If you have two, three, or 4 pillows.
All of these videos are available on YouTube under the username WSPT video. We're just not going to play them right now, and I guess that's it. So Jason, just give us a little wrap up.
So in review, there are many different issues that can come up with the neck. A lot of them related to postural issues, some from traumatic issues. Any questions going forward, please give a call to the clinic and ask whether it's something that you just want to use for advice, something maybe you should or shouldn't be doing, or if it's something more serious that you think you need medical attention for. We'll be happy to answer any questions and direct you in the right place. Thanks.
Thank you so much.